Imagine you're a parent
Mm-hmm.
back in 2015,
Okay.
and you're living in like a wealthy Seattle enclave,
Okay.
surrounded by families just like yours.
Yeah.
But here's the thing.
Yeah.
1 in 5 of the children in your community are unvaccinated.
Wow.
Why? The shadow of the autism vaccine myth,
Right.
it's still lingering,
Yeah.
casting this doubt and this fear,
Mm.
even years after it was debunked.
Yeah.
Today, we're going to do a deep dive into this myth,
Okay.
its origins, and the evolving understanding of autism itself.
It's really fascinating how this myth became so deeply intertwined with the way we perceive autism to really kind of grasp its impact.
Yeah.
I think we need to go back in time,
Okay.
trace the history of how autism has been understood,
Okay.
and uncovered the societal forces
Yeah.
that shaped those perceptions.
Okay, so let's rewind the clock to
Uh,
the early 20th century.
All right.
It was a time when autism was shrouded in mystery and misunderstanding. It was often miscategorized,
Yeah.
lumped in with things like schizophrenia,
Mhm.
or even blamed on parenting styles.
Yeah.
Can you imagine the weight of that on families?
It's really heartbreaking
Yeah.
to consider the guilt and confusion that
Yeah.
parents must have faced.
Right.
Two pioneers in the field emerged around this time,
Good.
Leo Kanner and Hans Asperger,
Okay.
but they had contrasting views.
Okay.
And those views had a lasting impact on how we understand autism today.
Right.
Kanner was working in the U.S.,
Okay.
and he saw autism as a very rare and severe condition,
Okay.
while Asperger, who was practicing in Vienna,
Yeah.
viewed autism as more of a spectrum,
Yeah.
encompassing a wider range of presentations.
Oh, so more like how we view it today.
Exactly, but tragically, a lot of Asperger's work was lost during World War II,
Wow.
and that left Kanner's perspective
Oh, wow.
to really dominate the field for decades.
It really makes you wonder how our understanding of autism might have evolved differently. If Asperger's insights had been widely known earlier.
It does.
Yeah.
And unfortunately, the misunderstanding didn't end there.
Oh, no.
We then have the emergence of the theory of the refrigerator mother,
Right.
championed by Bruno Bettelheim.
Okay.
And he essentially blamed parents, particularly mothers,
Oh,
for their children's autism.
Oh, so he's saying that they caused it.
Right, suggesting their emotional coldness caused the condition.
That's awful.
Yeah, it's
That is-
almost impossible to fathom the burden of blame
Yeah.
placed on those parents.
Yeah, who are already grappling with the challenges
Exactly.
of raising a child they barely understand.
Yeah.
Thankfully, Bernard Wimland, a researcher and father of an autistic child,
Okay.
challenged this harmful theory with his book Infantile Autism.
Yeah.
So he was really instrumental in shifting that focus away from blaming parents.
He did, but
So-
it's important to note that he also promoted
Okay.
some alternative cures for autism,
Okay.
some lacking scientific backing. Ah, I see.
This underscores this recurring theme in
Yeah.
autism's history.
Yeah.
The desperate search for simple explanations
Yeah.
and quick fixes,
Yeah.
even in the absence of solid evidence.
Right. Even if it's not really there.
Exactly.
It's a reminder that even with good intentions, misinformation can take root,
Absolutely.
especially when people are desperate for answers.
Yeah.
And it wasn't until 1980
Wow.
that autism was finally recognized
Okay.
as a separate diagnosis.
Yeah.
In the DSM, the Diagnostic and Statistical Manual of Mental Disorders. Think about that. For all those years,
Yeah.
it wasn't even formally acknowledged
Right.
as its own distinct condition.
That's right.
Wow.
This delayed recognition speaks volumes
Yeah.
about the lack of understanding and awareness
Yeah.
surrounding autism.
Right.
But then in the 1980s,
Okay.
we see a turning point
Okay.
when Lorna Wing, a British psychiatrist,
Okay.
rediscovered Hans Asperger's work,
Oh, wow.
bringing this concept of an autism spectrum.
Back into the conversation.
Right.
This rediscovery helped broaden our understanding, moving away from Kanner's narrow view.
Right.
And around the same time,
Yeah.
a landmark piece of legislation,
Okay.
the Individuals with Disabilities Education Act, or IDEA,
Right. Idea.
was passed in 1990.
Right.
You're probably familiar with IDEA,
Yes.
but it's worth revisiting its impact
Okay.
because for the first time, schools were required
Okay.
to provide support and services for
Yeah.
students with disabilities, including those with autism.
Wow, that's huge.
It was
Yeah.
the passage of IDEA led to a surge in diagnoses
Right.
as children who were previously overlooked
Yeah.
or mislabeled
Yeah.
finally started receiving the help they needed.
Right. So it's not that suddenly there were all these new cases. It's just that now they were actually being diagnosed.
Now they were being recognized.
Okay.
So while this increased recognition
Yeah.
was a positive step,
Yeah.
it also contributed to a misconception
Okay.
of an autism epidemic.
Right. So people saw the rising numbers.
Exactly.
And they assumed something was causing this sudden spike.
Right.
Rather than acknowledging that it was likely due to improved awareness.
And diagnostic practices.
Right.
Yeah.
So this fear of an epidemic,
Right.
coupled with, that ongoing search for answers, created fertile ground for misinformation to take hold.
Absolutely.
Setting the stage for the emergence of the vaccine myth.
Yes.
So that's what we'll pick up next time.
Sounds good. And that's where Andrew Wakefield enters the picture.
Right.
A British doctor who in 1998 published a study
Yeah.
that would send shockwaves through the medical community
Okay.
and ignite a firestorm of controversy.
Yeah.
His paper suggested a link between the MMR vaccine and autism.
So Wakefield's claims, despite being based on flawed and ultimately retracted research,
Right.
spread like wildfire.
They did.
Fueled by this sensationalized media frenzy, he held a press conference.
Right.
And suddenly the fear
Yeah.
that vaccines could cause autism
Right.
became very deeply embedded in the public consciousness. You see, this fear tapped into this primal instinct
Right.
to protect our children,
Yes.
even if it meant rejecting scientific consensus.
And that's the insidious nature of misinformation.
Yeah.
It preys on our vulnerabilities, our anxieties,
Yeah.
and our deepest desires to keep our loved ones safe.
Right.
Wakefield's study was eventually thoroughly debunked,
Right.
his medical license revoked,
Wow.
but the damage was done.
Right.
The seeds of doubt had been sown,
Yeah.
and they continue to bear fruit even today
Right.
in the form of vaccine hesitancy.
It's a stark reminder of how a single piece of misinformation,
Yeah.
particularly when amplified by the media and celebrity endorsements,
Right.
can have a very far-reaching and lasting impact on public health.
Absolutely.
And the vaccine myth wasn't just confined to the realm of scientific discourse.
No.
It seeped into popular culture,
It did.
finding a voice in celebrities like Jenny McCarthy,
Right.
who, after her son's autism diagnosis,
Yeah.
became a vocal proponent of the vaccine autism link.
Yeah, and her platform and
Right.
her very emotional appeals
Yeah.
resonated with many parents
Right.
who were struggling to come to terms
Right.
with their children's diagnoses.
Right. So she positioned herself
Yes.
as a mother fighting for her child.
Exactly.
And her message, however unfounded,
Yeah.
provided a sense of agency
Right.
in the face of this complex
Yeah.
and often overwhelming condition.
It's understandable why parents who are desperate for answers would cling to any glimmer of hope,
Yeah.
even if it meant embracing a theory that lacked scientific validity.
Right.
And unfortunately, the vaccine myth gained further traction
Oh, no.
when political figures
Right.
like Barack Obama and John McCain
Okay.
during the 2008 presidential election
Yeah.
acknowledged the public's concerns about vaccines and autism.
Right. So their statements, though likely intended to acknowledge those public fears,
Right.
inadvertently legitimized the myth
Yes.
in the eyes of many,
Exactly.
further muddying the waters and making it even more difficult to separate fact from fiction.
This underscores
Yeah.
how pervasive the misinformation had become,
Yeah.
influencing public discourse at the highest levels.
It's a cautionary tale
It is.
about the importance of critical thinking and the need to very carefully evaluate information,
Yes.
especially when it comes to matters of health and well-being.
Absolutely.
And as if the vaccine myth wasn't enough to contend with,
Right.
another layer of complexity was
Okay.
added by Autism Speaks,
Okay.
a prominent autism advocacy organization in their early years.
Yeah.
They embraced a battle narrative,
Right.
framing autism as a tragedy to be cured
Yeah.
rather than a difference to be accepted.
Their messaging. And particularly a very controversial 2009 ad
Okay.
portrayed autism in a very negative light,
Right.
fueling fear and stigma.
It's unsettling to think about the impact of this messaging it must have had on autistic individuals,
Yeah.
especially those who were coming to terms with their own identities.
Right. Being told that you are a burden,
Yeah.
a tragedy to be eradicated,
Yeah.
can be incredibly damaging to one's self-esteem and
Yeah.
sense of belonging.
Thankfully, Autism Speaks has since evolved its messaging,
They have.
moving away from the language of cure,
Yeah.
focusing more on acceptance and support.
Mm-hmm.
However, the legacy of their early campaigns still casts a long shadow.
It does.
And it serves as a reminder
Yeah.
of how even well-intentioned organizations
Right.
can perpetuate harmful stereotypes.
Absolutely.
So this entire saga,
Yeah.
from Wakefield's discredited study to the fear-mongering campaigns, highlights this critical need for accurate information and representation. For far too long, the narrative surrounding autism
Right.
was dominated by those outside the autistic community.
Yeah.
But thankfully,
Thankfully,
that's starting to change.
it is.
Autistic self-advocacy groups have emerged,
They have.
challenging those prevailing narratives
Right.
and demanding to be heard.
They're reclaiming the conversation. Right. Advocating for their own needs and rights.
Yes.
And promoting a vision of neurodiversity.
Yeah.
Where differences are celebrated.
Right.
Rather than pathologized.
It's empowering to witness this rise of self-advocacy,
Right.
to see autistic individuals taking control of their own narratives and shaping the future of autism research, policy, and support.
Absolutely. And speaking of shaping the future, let's shift our focus to the scientific advancements that have helped us move beyond the shadow of the vaccine myth and towards a more nuanced understanding of autism.
So while the vaccine myth was a major setback, it also sparked a renewed focus on understanding the true nature of autism. And thankfully, the scientific community's been hard at work.
Right.
And you've probably seen a lot of progress in this area.
Yeah.
Can you tell us about some of the key breakthroughs in debunking this myth?
Sure.
And what they've taught us about autism itself?
Well, one of the most significant developments was the sheer volume of research that emerged to address the concerns raised by Wakefield's study. Multiple large-scale studies involving hundreds of thousands of children were conducted.
Wow.
And the results were overwhelmingly clear. There is no link between the MMR vaccine and autism.
And these findings, they've been replicated time and time again.
Yes.
Really solidifying the scientific consensus
Exactly.
on this issue.
It's reassuring to know that rigorous research has debunked this harmful myth.
Yeah.
But it's an ongoing effort.
Right. How has this information been communicated to the public? Especially given how widespread that fear had already taken root.
Yeah.
It must have been and continues to be a challenge.
It is.
To counteract such deeply ingrained misinformation.
You're absolutely right.
Yeah.
It requires a multifaceted approach.
Okay.
Health organizations like the World Health Organization
Okay.
and the Centers for Disease Control and Prevention,
right, the CDC,
have played a crucial role
okay.
in disseminating accurate information
right.
through reports, articles, public service announcements,
right.
emphasizing the safety and efficacy of vaccines.
Yeah.
But beyond those official channels,
Yeah.
it's also about fostering these open and honest conversations within communities, families,
right.
and even in online spaces.
So it sounds like it's a collective responsibility.
It is.
To ensure that accurate information reaches those who need it most.
Absolutely.
But now that we've moved past the shadow of the vaccine myth,
right.
where does our understanding of autism stand today? You mentioned earlier this concept of neurodiversity.
Yeah.
Can you elaborate on that a little bit?
Sure.
And explain why it's such a crucial shift in perspective.
Well, neurodiversity challenges this notion that there's only one right way for a brain to function.
Okay.
Think of it this way. Just as we have diverse hair colors, heights, personalities, our brains are wired differently too.
Right.
Autism, ADHD, dyslexia, these aren't defects, but variations for human cognition.
So neurodiversity encourages us to embrace these differences.
It does.
Recognize the strengths they bring.
Right.
And create a society that supports a wide range of neurological profiles.
Exactly.
That's such a powerful concept.
It is.
Moving away from the idea of fixing or curing autism.
Yeah.
And instead focusing on creating environments.
Right.
Where autistic individuals can thrive as they are.
Exactly.
It seems like this shift in perspective aligns perfectly.
It does.
With the rise of autistic self-advocacy.
It does.
Giving a voice to those who were previously marginalized.
Yeah.
In the conversation about autism.
Absolutely. The emergence of autistic self-advocacy groups has been transformative. They're demanding a seat at the table.
Right.
They're challenging stereotypes. And they're advocating for research, policies, and support systems that are truly responsive to the needs of the autistic community.
So they're really taking ownership of their own place in research and policy.
They're reclaiming the narrative and showing the world that autism is not a monolith.
Right.
but a spectrum of human experiences.
It's inspiring to see this shift in power dynamics.
It is.
Allowing autistic individuals to define their own identities and advocate for their own well-being.
Absolutely.
But while we celebrate these advancements, what are some of the practical steps we can take?
Sure.
To ensure autistic individuals have the support and opportunity they need to thrive?
Well, in education.
Oh, okay. We need to move away from the one-size-fits-all approach.
Okay.
And embrace these individualized learning plans
All right.
that cater to the unique strengths and challenges of each student.
Okay.
This could involve incorporating sensory-friendly spaces, visual supports, social stories into the classroom environment, as well as utilizing assistive technologies that facilitate communication, organization, and social interaction.
So it seems like technology can be a real game changer.
I can.
Providing tools that empower autistic individuals to navigate the world.
Yes.
In a way that feels comfortable and accessible to them.
Exactly.
But what about beyond the classroom?
Right.
Employment opportunities for autistic adults have historically been limited.
They have.
Despite their often remarkable skills and talents.
Right, you're right.
What needs to change in the workplace?
Well, we need to challenge those traditional hiring practices that often screen out neurodivergent individuals and instead create pathways that recognize their unique abilities and contributions.
Right.
Some companies are already implementing programs to recruit and support autistic employees, focusing on creating supportive work environments, providing clear communication and expectations, and offering mentorship opportunities.
It's encouraging to see these initiatives.
It is.
But it sounds like there's still a long way to go.
There is.
What about healthcare? Access to quality healthcare that is sensitive to the unique needs of autistic individuals.
Absolutely.
Seems critical throughout their lives.
We need to ensure that healthcare providers receive adequate training to understand the nuances of autism. From diagnosis and treatment to ongoing support and management.
Right. So it's not just about, figuring out what's going on.
Yeah. But the whole journey.
Yeah, the whole journey.
Healthcare settings should be sensitive to sensory sensitivities.
Right.
Communication styles and potential anxieties that autistic individuals may experience.
So it's about creating this truly patient-centered approach.
It is.
That recognizes and respects the individual needs.
Exactly. But beyond these practical considerations, I think a most profound shift needs to happen on a societal level.
How can we cultivate a culture of empathy, understanding, and inclusion for autistic individuals?
It starts with challenging our own preconceived notions and biases about autism. We need to educate ourselves and those around us, engage in open and honest conversations, and actively advocate for policies and practices that promote inclusion and accessibility.
So it's about moving beyond just tolerance.
It is.
To a place of genuine acceptance and appreciation for that diversity of human experience.
Exactly.
So it's about fostering a sense of belonging, recognizing that autistic individuals are not a problem to be solved, but rather valuable members of our communities with their unique perspectives and contributions.
Exactly. It's about celebrating neurodiversity and recognizing that a truly inclusive society benefits everyone.
Well said. This deep dive has taken us on a journey.
It has.
Through the history, the science, the challenges, and the triumphs of the autistic community. We've debunked harmful myths. We've explored the evolving understanding of autism, and most importantly, highlighted the voices and perspectives of autistic individuals themselves.
And for our listeners, we encourage you to continue exploring this topic. To engage with autistic individuals and their families. And to challenge your own assumptions and biases. The quest for understanding and inclusion is an ongoing journey.
It is.
And each of us has a role to play
in
creating a more just and compassionate world.
Thank you for joining us on this deep dive.
It was my pleasure.
Until next time, keep exploring, keep questioning, and keep learning.